Hey, welcome to Complete Spine Solutions at Brookhaven. Come on in, I want to show you around. We have a beautiful state-of-the-art facility here. Our check-in process is the first stop on your tour here today. So we make check-in really, really easy. Basically, you fill out all of your forms online in the convenience of your own home. You hit the submit button, it comes securely to our server. There's no printing, simple, easy process, online, done at home. Once you come into the office, there's really not going to be any forms that you're really going to have to fill out here, so we're trying to make that process super simple, easy for you. There's not a lot of waiting. Our self-check-in area is an iPad kiosk. This is literally as simple as pushing a button, and then you can literally sign your name and fill out the forms. Whatever information you fill out here in the office, it comes to all of our workstations in the back, so the staff, including the doctors, will know exactly what's going on with you that day to better address whatever your immediate health concerns are. Area is really made to be comfortable, warm, and inviting for every patient. You can relax here before or after your treatment. All right, do you like to play with blocks? We do that a lot here at Complete Spine Solutions. We have blocks that we use for custom postural corrective exercises. The most common postural problem that people have is the hips are shifted forward, the torso's leaning back, and the head's sitting out like this. Have you ever seen somebody like that? Probably so, right? It's the most common postural problem. Well, what we do is we give patients warm-up exercise to do to start moving their spine in the right direction if they have that problem. I'll just demonstrate what that looks like. So we take the block, we put it against the wall, we have them put their shoulders back on that. We then have them stretch in a backward direction, bringing their hips back, their shoulders and their head back and their shoulders forward. So this type of position here that's a 1 rep. We have patients do from anywhere from 30 to 100 repetitions if that's what their problem is. And this helps get their body and spine warmed up to moving in a better, healthier position, taking stress off the spinal cord and also off of their spine, allowing them to be in a better, healthier position as that we're in a gravity environment. So this is our warm-up exercise area. Our postural corrective exercises are also custom for each individual person based on their mechanical problem. So we don't do cookie cutter anything in this office, not the adjustment, not our tractions, not our exercises. I want to just give you one more example of an exercise that we do here with many patients who have this problem. A very common problem is a straightened neck. We use this device right here to help stretch and strengthen the muscles that support that increasing curve. Now, not everybody has the same curve at all. Some people have a straightened lower neck, sometimes it's straight in the upper neck. If you've ever been to an office where everyone's doing the same thing, there's probably a problem. Ours is custom. So if you've got a straightened lower neck, you're gonna pull down this way. If you're straightened upper neck, you're gonna pull up in this position here. This exercise is just one of the many custom exercises that patients do to help restore normal structure to their spine, to get their spines in a better, healthy position. In addition, we also use the power plate. This is a whole body vibration device. It vibrates at 900 times a minute in 3 different directions. The power plate is used to accelerate the postural corrective process. Because of the contraction of muscles so many times a minute, whatever's done on the floor happens faster using the power plate. Welcome to our traction area. In this area, we have 2 universal traction systems. These machines are designed to stretch the ligaments of our spine. As we age, our ligaments tighten and hold us out of position. No matter how hard a person tries to stand up or sit up straight, the second they stop thinking about it, they're going back into their original poor, unhealthy position. So this equipment is designed to stretch those ligaments permanently. The only way to get a permanent stretch of ligaments, according to research, is by stretching those ligaments at a 10-minute clip. Anything less than 10 minutes doesn't make any permanent change to the spine. Those ligaments are only going to spring back to their original position. So you're essentially wasting your time. Now, I'm a big proponent of stretching. Anything less than 10 minutes is going to affect the muscles, which is great. To be more flexible, beautiful thing. We encourage people to do that. However, if you want to change the structure of the spine, you've got to do your traction for 10 minutes or longer. Each of our traction setups are designed to stretch the ligaments of the spine, custom for each person. So if someone has this forward head position, we're going to use this equipment to bring their head back and stretch that ligament. We might pull forward if we're trying to increase the curve. If their back is too curved like this, maybe that's going to affect their breathing. In fact, it could affect not just their breathing, it could affect stomach function. All sorts of organs in your chest cavity are going to be impacted by this increasing curvature. So we have this equipment designed to stretch those ligaments of the spine, allowing to stand up straighter and taller without even having to think of it. This is a permanent spinal structural change. This is one piece in the puzzle of restoring people's health. All right, here we go. This is the Dennerol table. We happen to have two of them here. Again, these are the only ones in Atlanta, which is really cool. These Dennerol tables are designed to correct, just like the other universal traction system, all sorts of postural spinal issues. So I'm laying on it right now for someone who has scoliosis. We use this device here. This is a ScoliRoll it's called. It's a type of orthotic to correct specific scoliosis problems. We test it, again, before we do it on any patient. Everything is all tested to make sure it's going to be effective, make sure the patient's going to respond. But basically, if someone's got a significant curvature that's convex on this side here, we're going to push into that convexity, have them lay on it. Again, the minimum time is about 10 minutes or longer on the ScoliRoll. They would be also given a ScoliRoll for home care. We have different devices that, speaking of home care, that people have to use at home. These are home exercises that are custom for each individual patient. We test it out and then prescribe it. I don't recommend people get something like this without it being tested. You just don't know how to use it, where to place it. There's plenty of stuff you can buy online, but if you don't know what you're doing, you could actually be making your problem even worse. So that's the Dennerol table. All right, right here we have our wobble chairs. These wobble chairs are designed to mobilize the lower back. So as we age, our lower back tends to get tight and can cause pain as well as stiffness and general discomfort. So what these chairs do, as you notice, there's no back to it, and the seat actually completely moves. And this type of motion helps allow us to mobilize the lower back. We have patients do circular exercises using this. It not only increases flexibility, but also rehydrates the discs. The discs are the soft cushions between each vertebra. They're made up of almost 90% water. So any joint that doesn't move in the body tends to break down, and including the vertebrae as well as the discs. This device is literally designed to mobilize that lower spine area and get motion back. And when you first start using this, oftentimes it's a little bit uncomfortable because you're sort of stiff, but once you get moving on it, things start to loosen up, and literally just after using this, people feel and function better. That's the wobble chair. All right, so this is our adjusting area. In this area, we reset the spine and nervous system into its proper, normal, healthy posture. All of our adjustments are actually done in the patient's mirror image. In other words, opposite. So if someone's leaning this way, we're going to adjust them this way. It's kind of logical. If something's leaning this way and you want it to be straight, you would of course push it into the opposite position. That's exactly what we do with the entire spine on each visit. We check posture before the treatment. Each time we're checking before the treatment, we're trying to see if you're holding from the last treatment. That's the first reason why. After the treatment, we're going to check the posture again. We check posture following the treatment to make sure that we've made a significant change in the structure, improving it into a more healthy upright position. People, after the adjustment, oftentimes they feel immediate relief, better function, more flexibility, and just feeling better and more energized. That's what happens in the adjusting area. In this room, this is our consultation room. In the consultation room, we meet with patients, get to know them, figure out what's going on there, really do a needs analysis to really assess what their pain points are, what kind of problems they're having, to make sure that it's a good fit. It's where they get to know us as well as we get to know them. In addition, once we take x-rays of our patients, we can see in real time and on the big screen exactly what the patient's problem is, and the patients get to really understand as we explain their x-rays. Did you ever go to the doctor and never really understand what they prescribed you, or what the medication does, or how it's going to help, or what the side effects are? That doesn't happen in this office. Patients are completely explained their x-rays, they totally understand what's going on, and we stay here and hash it out until they do. And we can really see on a very large scale exactly what's going on with their spine, where their degeneration might be, where their neck is in front of where it's supposed to be, what kind of mechanical problems they might be having, so that we can get them the best results in the shortest possible time. X-ray room. In our X-ray room, we do our radiographs. These are patient X-rays where we determine where there are mechanical problems in the spine. This is a very powerful 50 kilovolt system, which means it penetrates with an incredible amount of speed, reducing exposure time, and also reducing radiation to the patient. So this is a minimal exposure system and a high quality. It's the same type of quality you'd find in a beautiful hospital setting, except it's right here in our private clinic. So we get to diagnose where you have ligamentous injuries, mechanical problems, spinal misalignments, and degeneration to the bones as well as the disc. Our X-ray system is even more importantly used in analysis. We analyze all of your X-rays, and every patient gets a copy of their own X-rays on their return visit. When I go over all the results and explain everything to you, you'll receive a copy with a 15-page report explaining everything so that you can actually go home and share it with your family and have a better understanding, a deeper understanding as to what the real problems are. Our X-ray analysis system is using digitizing software where we can diagnose all sorts of problems that you really wouldn't get from any other doctor. So, welcome to the X-ray room. Thomas Edison once said, "The doctor of the future will give no medicine, but will interest his patients in the care of the human frame." Well, that doctor is here, right at our new facility here in Brookhaven, as well as our sister facility in Tucker. Complete Spine Solutions is here to help you recover your health as quickly as possible.